I think it's time to go to the following question. Natural cycles for IVF or mild stimulation. And in fact, the question is, what do you want exactly? Best pregnancy rate and acceptable complication rate, or no complication with acceptable pregnancy rate? I think, René, it was a question.
No, I'm sorry, I answered
could we have
because
the question?
I come in late. Okay.
You should move the
You
Natural
should move
cycle,
to the good question, the right one. Move, please. Next one, next one to the question. That's right. Sorry, previous. Okay, perfect.
So I think that, as I said this morning, there is a medical indication for natural cycle. It can be a choice for everybody, but I think there is medical indication. For instance, when you have a patient who have a cancer and you want to make a oocyte recovery, you don't want to stimulate them, or in poor responder, I think that it is an option to propose a natural cycle because you get the same result with a very low inconvenience. So I think that there is an indication for that. For the mild stimulation, I don't think that we're going back to the discussion of 2 hours this morning because it's something different.
It was a question. Who wants to answer or who wants to speak?
Maybe we should ask the audience, how many of you are using natural cycle at all in any part of the clinic? So very few, I guess it's less than 5%. How many of you use exclusively mild stimulation, which means they do not go over very small amount of, it's already taking the next question, I guess, because most of the people then are using conventional stimulation. How many of you using conventional stimulation? So I think the people have spoken and say their words, so that's why it is debatable and questionable where should we go with the stimulation.
Mr. Daya, you want to speak?
The concept of the pure natural cycle seemed to have some merit initially, but when you look at the evidence, we're still struggling with low rates of success, but the cost from the laboratory is still quite high. If you look at minimal stimulation, you will then improve the chance of success, but we still have the same problem with the cost in the lab. And when we look at it from a cost perspective, and I have to keep coming back to this issue of cost because that's what it boils down for patients, most women are willing to fork out the money for a conventional stimulation because you get not only an opportunity in a fresh cycle, but you also have frozen embryos that you could use later on. In a minimal stimulation situation, that doesn't occur to the same level of efficiency. So unless we can bring down the costs of the laboratory, I think that the issue of the minimal stimulation or the true natural cycle is still one of debate. If we can bring those costs down, then I think it becomes a contest again that people will move to, especially those in areas where economics are a very significant problem. I mean, they're a problem everywhere, but even more significant if you can bring those costs down. Right now, our issue is big laboratory costs, and that's what we need to focus on.
I think you always have to find a compromise with your patient, and you have to see the risk and the benefit. And I think the risk of mild ovarian stimulation is very low. The risk of OHSS and also the risk of multiples, you can transfer one embryo, freeze the others. So, but the benefit is high for the patient. Therefore, I would say if you want IVF, you should do a mild stimulation to get 5 or 7 oocytes.
Is 7 a mild stimulation? Is 7 oocytes a mild stimulation? That's the question.
5 to 7.
Oh, okay.
in an 18-year-old. I will politely disagree with Professor Dietrich, and I don't want to preempt my talk on Sunday, but I think what Professor Dyer said is absolutely correct on the cost front, but I also think that the issue is really an even larger one that affects our specialty in a much wider sense, and I think the issue can be framed in a simple question, and that question is, are our patients entitled to maximum IVF pregnancy rates? If you believe that the answer to that is affirmative, that our patients are entitled to maximal pregnancy rates, then I think it is time for us to do exactly that. Give them maximum pregnancy rates. And if we have ideas such as mild stimulation or natural stimulation or PGS to improve outcomes or whatever the grand idea of the moment may be, then those should be done as investigational studies with full informed consent, because patients want nothing more when they come to us than to get pregnant quickly.
Okay, if I understand, all of us, we want the best pregnancy rate. So next one for you.
Well, the next question